Can you cross your arms for me and put your hands on the opposite shoulders? That's it, just like that, and breathe normally for me.
Have the patient place his hands on the opposite shoulders and breathe normally. Now examine the posterior thorax, beginning with inspection. Observe the chest for contour, symmetry, and deformities. Also, inspect the overlying skin.
Okay, tell me if this hurts anywhere.
Then, palpate the chest wall to locate any areas of pain or tenderness, or to assess any lesions or abnormalities you may have found during inspection. To assess lung expansion, place your thumbs close to the patient's spine at the level of T10 and spread your fingers lightly across the lateral thorax.
Okay, please inhale and exhale deeply for me.
Ask the patient to inhale and exhale deeply and fully while you watch the divergence of your thumbs and feel for the range and symmetry of movement. Next, systematically palpate for tactile fremitus.
Okay, I'm going to put your hands on your chest and please say 99 every time I touch you.
99.
Feel for the vibrations of tactile fremitus as the patient continues repeating 99, blue moon, or some similar phrase consisting of 2 or 3 equally accented syllables. Using the edge of the hand is also common. Identify areas of increased, decreased, or absent fremitus. Continue the examination by percussing the chest in a systematic manner, moving down the thorax and going from side to side as demonstrated in a ladder pattern. Remember that only the posterior surface of your pleximeter finger should be in contact with the chest wall. Wrist motion should be relaxed and fluid as you make 2 strikes with your third finger. Percuss down the chest wall from the apices to the bases of the lungs. Listen to the intensity, pitch, and duration of your percussion notes, and note the sense of vibration. Then decide what kind of notes you are hearing. Normal lungs are resonant. Locate any areas where you hear abnormal dullness. Next, use percussion to identify the level of the diaphragms and measure diaphragmatic excursion.
Now, if it's all right, I'm going to put some ink marks on your back. So breathe all the way out and hold it for me, please.
Then percuss downward from above the expected level of diaphragmatic dullness until dullness is definitely heard.
Okay.
After gaining the patient's permission, mark the level of full expiration. Next, have the patient inhale deeply and hold it in. Then percuss downward to the level of dullness at full inspiration and mark it. Repeat this process on the other side. Then measure the distance between the expiratory and inspiratory levels of dullness. The distance is normally 5 to 6 centimeters.